Good morning, Brainiacs. As we close in on 5,000 subscribers, I can't begin to express how thankful I am and how surprised I am at the rapid growth of this channel. I never would have imagined when I started this that there would be that much interest. Honestly, I was hoping that within about 6 months or maybe a year, we'd be where we are now, but after a month, the channel's off to a great start. And so I want to thank all of you and really express my appreciation and my surprise. It's been really an amazing experience so far, and the feedback I've gotten from you all has been wonderful. I was sitting at my desk this morning and came across something that I received as a resident that I've now actually passed on to my own residents in their training, and that would be the guiding principles for neurosurgical training. So where I trained, one of my mentors was really big on these principles and actually typed them up for us, and I loved them so much that I actually brought them to my current institution, where I actually have them printed out, laminated, and given them to all of our new residents when they start their residency. So as I was reviewing this today, I thought I could talk to you all about these principles and how they really have kind of affected my career and the way that I treat patient care and education and research. And so I wanted to take today to kind of go over what I consider to be the 10 most important guiding principles of neurosurgical training. So number one, that's remembering that caring and safety come first. Caring, healing, teaching, learning, and discovering. Hopefully that goes without saying. Number two is to practice compassion. People may forget what you did or said, but they'll never forget how you made them feel. And that's so true. It's amazing that you can think that you've been perfectly clear with an explanation of a surgery or outcomes or meeting with a family, delivering bad news, good news, whatever it is. The really important thing to remember is that it's not always what people hear, but how you express it. And I think that form of communication that you use and develop and the style that you have with your patients really goes a long way to sort of making them feel like they're well cared for, or the opposite. If you're not a good communicator, I know this is something I've touched on in my other videos, that can certainly affect people's impressions of you. But if you show compassion, that's always the key. So that's been really, really, really key for me in my career. Number three, be respectful. The world belongs to everyone. Treat your patients as if they were your family. What you say and do reflects on the entire department, and that's so true. So along with being a good communicator, you have to respect where people are coming from. You may not always agree with their decisions. They may not always listen to your best medical advice, but people have their reasons for what they decide. At the end of the day, they're adults. They have autonomy. We need to respect that and their wishes and do what we can to help them as much as they'll let us. So I try to remember that every day. Number four is to be honest and trustworthy. This is critical to our specialty. Say what you mean and mean what you say. Honesty and trustworthiness, that's key, especially as I work with someone for the first time, the new residents when they come in. I have to believe and I have to understand that they're always going to be honest and trustworthy. And this isn't always sort of a black and white thing. You'd think, how could a doctor not be trustworthy? How could they not be honest? And it's often not that simple. So for example, imagine that you were reviewing 20 patients, your attending physician was calling you, looking for updates on patients, and they asked you a simple question, what was the sodium value, or what was the red blood cell count on a patient? And you think you remember, you're not totally certain, you may have been mixing it up with a different patient, but you spout off that number and then realize later on that actually wasn't the right value. Again, ends up being a white lie, but it's obviously important. You have to be accurate, you have to be honest, you have to be upfront. And the better thing to say in that situation is, I'm almost certain it's this, but I can't be totally certain, so let me review that. Let me get back to you with the actual number. That's what I want to hear. So even if it's admitting that maybe you didn't know something that you should have, I'd much rather you be honest. And again, that builds trustworthiness as opposed to trying to come up with an answer that you think is right. Number five, practice professionalism. Look your best each day, and when the going gets tough, remember to check your attitude. Talked about this in my last video on sort of the 5 traits of successful medical students, and professionalism is key. No matter the circumstances, no matter what's going on in your personal life, no matter what stress you're dealing with, highs, lows, whatever it is, you have to keep an even keel at work. You always have to remember that, this is a profession. It's not just a job, but we're taking care of people at their moment of need. You have to maintain that high level of personal conduct at all times. Number 6, demonstrate excellence in everything you do. We want you to be the best. The department is committed to training the neurosurgical leads of the future. And I think that's really true of any academic department. And part of the reason why I love my job so much is the opportunity to actually, shape the training of young trainees and to step in with residents sort of at all experience levels, and really mold them, and again, pass on what I think is important. Hopefully they learn from me both what they do and don't want to do. You take away good and bad from every teacher that you have, but I think that opportunity to pass on excellence and sort of what I believe are my personal standards for excellent patient care. I love teaching that, and I honestly want all my residents to be even better than I am. I'm not succeeding unless everyone that I've taught is doing a better job than I am. So that's how I see those things coming into practice and demonstrating excellence in everything you do. Number 7, promote patient safety. Give 110% every day, and your diligence and attention to detail will protect you and your patients. And this really comes down to both attention to detail and thinking about safety. Whenever I enter an operation or I'm counseling a patient on an operation, I always think to myself, what could go wrong? What's the worst thing that could happen? Obviously, we always want the best, but you have to prepare for the worst. And so I think having contingency plans in place no matter what, assuming that everything's not going to work out, and then being ready to attack that, at the moment that something maybe doesn't go right, that sort of mental preparation will really, really serve you well. And also always kind of remind you of how important patient safety is. If you're thinking about what could go wrong, then you're thinking about how to keep your patients safe, and that's really important. Number 8 on our list is continuously working on improving your communication. It takes a team to be the best. I've talked about this at length, but we could all get better, and being a better communicator will serve you well no matter what your walk of life. Number 9, knowledge is key. Focus on what you don't know. Read, practice, and repeat so you can be your best. For some reason, I thought that when I finished residency, the learning would be done and I'd be more or less a finished product, but that couldn't be further from the truth. I'm learning every day. There's always something to study. As medical science and research advances, it's incredible, how much information there is out there and how much you need to be able to parse through it, critically analyze it, and apply it to your own practice. So again, that sense of curiosity that we all need and maintaining sort of that mental and intellectual rigor, very, very important, especially in a field as advanced as neurosurgery. And then finally, number 10 is to be thankful. Remember, we are members of a privileged group and that we have been given the opportunity to care for the most complicated neurosurgical patients. It is our duty to provide the best possible care for everyone in an environment of teaching, learning, and discovery. So pursue personal excellence. Pursue excellence for the benefit of your patients, for your own development and growth, for the strength of your department, for the efforts of your research. If you're trying and really demanding the best of yourself with everything you do, everyone around you is going to benefit. Your trainees are going to benefit, your patients are going to benefit, your scientific experiments and your research is going to benefit, all of your collaborators. Really can't say enough how important that is. I'm so grateful to do what I do. It obviously took a lot of work, but I never forget how privileged a position I'm in and how much that means to me and how much, my life has really given a lot of meaning and just sincere thanks that I have for what I'm able to do. So anyway, I hope that provides a little bit of inspiration on this Monday morning. Again, the 10 guiding principles for neurosurgical training that I passed on from my residency now to my residents. I hope those words have a lot of meaning for some of you and help you sort of grind through difficult moments and remind yourselves what this is really all about. So again, hope you all have a great week. Thank you again for all your support. I just can't believe how quickly we've grown, and I'm really looking forward to what's happening next. So in the future, we're going to be looking at more surgical videos, interviews with other attendings and faculty, highlighting some neurosurgical research. A lot of the things I talked about in my intro video, really excited to get to the channel. So stay tuned, a lot of great things ahead, and thank you all. Look forward to seeing you next time.